Hello, my name's Cody. I'm going to be your student nurse today. I'm here to perform a complete head-to-toe assessment. Should only take about 15 to 20 minutes. Do you have any questions before we get started?
Nope.
Okay, then I would make sure to provide privacy, raise the bed to working height, perform hand hygiene, and do my 2 patient identifiers. Can you please confirm your name and date of birth for me?
April Stout, April 1st, 1980.
All right, now I'm going to assess the patient's dress and hygiene, make sure that things are up to par there. The patient is on room air and is having unlabored breathing. So now I'm gonna assess the patient's mental state. So the patient is talking to me, so I know their speech is good. They just confirmed their name and date of birth, so that's their person. Do you know where you are today?
At the hospital.
Okay, do you know what year it is?
2025.
Do you know why you're here?
For a checkup.
Okay, so the patient is ANO times 4. All right, now I'm gonna start with my head to toe assessment. So again, I've washed my hands, performed hand hygiene. So we're gonna start with the head. So I look at the skin color, which is appropriate for ethnicity. I'm gonna feel for any lumps or masses. I could also look for that, but feel for any lumps or masses. Take a look at the patient's lips. They're appropriate for ethnicity, pink, and there's no signs of cyanosis there. I can then use my pen light, look in the patient's ears, and look in their nose for any redness or drainage there. Okay, now I'm going to go ahead and take a look in the patient's eyes, look at their pupils. 2 in each side. All right, their pupils are equal, round, reactive to light, and accommodating. I also want to note the color, so the sclera is white. I'm going to pull down, and the conjunctiva is pink there as well. All right, we're going to move on to the neck now. So I'm going to feel again any lumps or bruises, or lumps or any pain here. Okay, I'm now going to feel the carotid pulses. All right, and I feel those, that's gonna be a 2+. I could also examine the JVD, but JVD is absent. All right, now I'm gonna take a look at the patient's arms. So just hold your arms like that. All right, so color is appropriate for ethnicity, temperature is warm, and moisture is dry. Now I'm going to feel the turgor, which is elastic, and I'm also gonna check the capillary refills in both hands, which is less than 3 seconds. Now I'm gonna feel the brachial and the radial pulses, which are both 2+. And I'm now going to do kind of the same thing on the legs. So color is appropriate for ethnicity. We're gonna feel temperature is warm, moisture is dry. I'm also on the legs going to check for any edema on both legs, so there's no edema. I can feel the posterior tibial pulse here, as well as the dorsalis pedis pulse. And again, I'm going to check the capillary refills in both feet, which are less than 3 seconds there as well. All right, I'm now going to check for any skin breakdown anywhere, so I can look behind the elbows. I'm gonna look at the wrists, the hands, the knees, the heels, the ankles. No skin breakdown is present. I'm also gonna look for this on the back as well. So I'm gonna look at the shoulders, I'm gonna look at the back, I'm gonna look at the hips and look for any skin breakdown. Okay, now I'm going to assess all of the heart sounds. So we're gonna be listening to 5 heart sounds today. We're gonna do aortic, which is the right of the sternal border in the 2nd intercostal space. We're going to listen for the pulmonic, which is left of the sternal border, 2nd intercostal space. We're going to do Erb's point, which is left of the sternal border, 3rd intercostal space. Tricuspid, which is left of the sternal border, 4th intercostal space. And then mitral, which is left of the sternal border, 4th or 5th intercostal space. I also want to listen for S1 and S2. S1 can be found at the apex, and S2 can be found at the base. So I'm now going to listen for that. All right, so again, I'm just listening to your heart here. Just breathe normally. so I heard all of those, and the patient had regular rate and rhythm, S1 and S2 heard. So now I'm gonna count the heartbeat for 1 minute. So I'm just gonna hold this here. All right, 72 beats per minute and regular rate and rhythm there as well. All right, now we're gonna do the lungs assessment. So first I'm gonna check the symmetric expansion. So I'm just gonna have you have your arms out to the side. I'm just gonna put my hands here, and I want you to take a deep breath in and a deep breath out, okay? All right, in and out. All right, and then I'm also gonna check that in the back as well. Just turn a little bit. All right, so breathe in and out. All right. Well, I have the patient back here. I'm gonna listen to my 9 different lung places on the back. So deep breath in and out each time I move my stethoscope here. Okay, in and out. Alright, so I listened to all 9 of my different places, and I heard clear breathing, no adventitious sounds. Now I'm going to come back to the front here, and I'm going to listen to all 5 different places on your front. So again, just deep breath in and out in each place, okay? Alright, deep breath in. In and out. Alright, so again, I heard clear breath sounds and no adventitious sounds heard there either. Alright, now I'm going to have you lay back, and we're going to do our abdomen assessment here. So first I'm going to get down, and I'm going to look at the contour, which is flat. Alright, I'm going to look for any, cuts or scrapes, kind of anywhere on the body, honestly, any, just wounds, anything like that. So now I'm going to listen to the abdomen starting in the right lower quadrant. All right, right, normoactive bowel sounds heard. All right, now I'm gonna palpate your abdomen. Just let me know if you feel any pain anywhere as I do this, okay? Any pain? Any pain? Or any pain there? Okay, all right, you can sit back up. All right, and that abdomen is going to complete our assessment. So now I would thank the patient. I can lower the bed back down, perform hand hygiene again. I would also make sure the patient's wearing their non-skid socks if need to, raise the side rails up ×2. And do you have any other questions for me today?
Not today.
All right. I also wanted to note that while I did the heartbeat, I also counted the respirations, which were at 14 breaths per minute. So, I think that's all for charting. And yeah, thank you.